Okay, so next slide. Okay, perfect. So Bassett gave like a small intro, but essentially the goal of this lecture series is to help you guys out on writing systematic reviews, which can be done pretty independently from a student perspective and led through a student group. So we're going to go through kind of what the basics of what a systematic review is, and then each consequent series will kind of chat about what the next step is for that. Okay, so essentially a systematic review is a collection and summary of all existing research that can be publicated or not publicated that's related to a topic you want to investigate. So basically, in a very easy to understand, digestible way, a systematic review is essentially a book report on a specific topic of your own choosing. Um, Next slide, please. So systematic reviews can cover a wide array of topics. Your systematic review can be focused on clinical presentations, such as like how often a certain patient is diagnosed with certain symptoms onset, and then diagnostic techniques. You can cover procedural techniques, treatment options, and then we're going to go into specific examples on all of these. Really, you can do a systematic review on anything that you personally found interesting, whether you've seen in clinic or something that you're reading up about and want to learn more about. So one thing we wanted to chat with you guys in case this ever comes up for you guys is what is the difference between a systematic review and a meta-analysis? So essentially a meta-analysis is a specific type of systematic review that uses biostats to investigate certain variables in your systematic review. So essentially, if you're not really trying to do any biostats or you don't have a biostatician available to you, then you can move from doing a meta-analysis into a systematic review. But if you have a specific variable that you really want to compare and contrast using biostats, then you can find a biostatician or try to do the biostats yourself and move into a meta-analysis. So it just depends on the skill set or what resources you have available on whether you can do that biostats or not. So for the curriculum of this course, the first thing we're going to work on is developing a research question. So once you develop that research question, it's important to identify a standard set of keywords or phrases that you're going to use to collect various publications from a few databases. After that, we're going to go over with you guys on how to appraise papers. Basically, where you want to test the integrity of certain papers and make sure that your systematic review is not just based on papers that either have a lot of conflicts of interest or maybe the conclusions were kind of muddy. So we want to make sure that you guys are using high quality papers in your systematic review. Fourth, we're going to be showing you guys how to collect and analyze the data, how to come up with outcome points that prove either towards or against your question. And then finally, use all that information to write the manuscript on what you found in this investigation. So we have a few questions or examples for you guys if you guys are new to the field, whether you're preclinical or in your clinical setting. So one common thing is you could have a patient presenting with a symptom onset that's kind of unique. So for example, sometimes a UTI patient may present with only increased urinary frequency as opposed to dysuria and those types of symptoms. So that could be something you would want to write a systematic review on. For example, if you want to go through diagnostics, you could say whether clinical versus lab diagnostics are important for diagnosing PCOS and kind of talk about diagnosis delay and how that affects patient care. If you are really into procedures and more technical things, you could go into like why certain lumbar inner body fusions are preferred to others and talk about like tissue damage and organs nearby that could be perforated and things like that. And then lastly, which might be a more common option, is you can investigate treatment options. So example would be sciatic patients. whether you would want them to continue their activities of daily living versus rest and ice, and so on and so forth. So these are just some examples. You could take any presentation you find and kind of plug it into these different scenarios and see if that's something you're interested in investigating further. And then from there, develop your research question. So in developing a research question, it's really important that you have the foundation of your research team kind of help you build towards being able to either find a decent question by either consulting a specialist. That's a common way. If you are in your clinical years right now, you could go chat with one of your preceptors and ask about a common misnomer in the field or two treatment options that are more a personal choice or dealer's choice for your patient care plans, and then from there kind of see what's going on and figure out a question. Or it could just be that you want to become an expert on a topic and then from there find a specialist who works in that field. So you can start either or, whatever resources are most readily available to you. So we are going to be using this patient example throughout the lecture series just so that you guys can follow along and make it a little bit easier and kind of match up your work with our work. So for this systematic reviews example, we're going to be having a patient come in with right-sided lower back pain that radiates down their posterior side of their lower extremity. In clinic after performing a straight leg test, which ends up being positive due to eliciting pain, we're going to diagnose this patient with sciatica. However, there can be controversies about the different treatment options for sciatic pain. So are we going to suggest resting and icing for the next few weeks to this patient, or are we going to suggest that they remain active but avoid the motion that produces the pain? So our research question is going to be developed on comparing and contrasting the treatment options for sciatica. This doesn't have to be what you guys are following. It's just going to be an example that we're going to continue throughout the series that you guys can follow along.
Rotating horse.
Okay. So that's going to be our example. And then okay, so the next steps to get this kind of off the ground and get started is we want you guys to really find other students that are interested in the same topics as you. One way to also kind of facilitate this discussion is talk about what each other's strengths and weaknesses are. Talk about what research you've previously done, what fields you feel comfortable with, and try to match up to where you find a group that's well-rounded. Like if someone's good at case studies and you've never done one before, it might be worth it to work with that person because then you'll learn a little bit, they'll learn a little bit, and you guys can have a really well-balanced team. Another thing is to plan out and delegate tasks to be completed for each member. Time management is super important. You guys are really busy and you guys have a lot going on. So make sure you plan accordingly, give each other time to work on stuff and keep that open communication. And then another really important part is finding a PI. So that's either going to be, it doesn't have to be a specialist, can be a generalist, can be a faculty member from your school, just anyone who is in the field. This is also going to help when it comes down to wanting to send your systematic review to different publication, different journals and stuff like that. They can probably help guide you over to what journals your systematic review is going to play best in. So this is going to be the next important 3 steps for you guys. I think right now we're going to have you guys go into groups. Is that right, Bessa? And kind of chat with each other and see if you guys can come up with some groups right now.
Yeah, inshallah. Thank you, Christina, for that amazing presentation. So in summary, what a systematic review is able to do for you as a medical student is the biggest barriers usually for research is finding data and finding a mentor, right? And a lot of us don't do research because we don't have a doctor that's looking for research and we don't have the data. Essentially, what a systematic review does is you can find papers and that is your data. So you read 15 papers on a topic and you talk on them. And then it's a great way to network because you have this idea, you have this proposal, you could reach out to this big shot doctor in your program and be like, look at what I have. So Christina, thank you so much for, putting it down to its basic levels. So right now, what we're going to do is split everybody in breakout rooms. If not, if you can help out with that right now. And we're gonna stop the recording. So in these breakout rooms, we really want you guys to just talk to people, kind of share, hey, I've done a systematic review before, I've written a paper, or I have no experience at all. All of that's cool. But what we can do is try to identify somebody who wants to lead a project, has a question in mind, maybe a specialty. For example, if you find a couple people really into like anesthesia, and you want to do anesthesia, maybe you guys could just, share numbers, start looking into research, and move forward. So that's going to be everybody's homework for the next month, is finding a group of other students that are interested in your topic, and trying to find a research question that interests you. And then all the other stuff like databases and like writing a query and looking at data, all of that is just going to happen as it comes, and we'll hold everybody's hands, definitely figuratively, as we move down that road.
I also wanted to say one thing really quick. So I know as medical students, and we're just getting into the research world, that we always think about publication. I just got to get a pub, that's the cherry on top. But I want to talk about research experiences in general. So when you're able to put all of this together and you make it into an abstract with your coworkers, your classmates, things of that nature, that is still a big feat. That is not something that is just simple and easy to do. So I want you guys to feel proud of that. And if you're able to take it to a conference, take it to a presentation where you either get accepted for a poster or you get accepted for an oral or a podium, these are also big feats in research. So even when you're applying for residency in your ERAS application, there is a section that will say, like, I haven't opened the ERAS yet, but it will say like publications, poster presentations, conference appearances, things of that nature. And a big part of the research community isn't just getting it published. It's also being able to sell your story in front of a crowd, in front of other physicians, in front of other people in that specific field. So I want you guys to just keep that in mind, that taking it to conferences but not being able to get it published is still something that's to be proud of, and something that would look good on your resume in the research world.
Thank you, Natin.